out on the
You have
stream.
junk behind you.
There we
No.
go. Oh, Jessica is
No.
horrified that we have junk behind us. So we will run to the other room and get out of the back office with junk in it. Boom.
Leave that here.
Now let's go back to the back. Turn some lights on. Walking through the clinic. Man, those lights, all the overhead lights are casting funny things on it. All right. Well, we were trying to decide what we were going to talk on. And I don't know, you've been reading a lot lately and listening to a lot. You're on your personal mission for hormone relief for people.
I am on a personal mission for hormone relief. And I will just say I am very disappointed in the medical people, and actually all of the medical people, because it's probably the first thing that people need to check. Actually, of how many 6 people we've checked their hormones, all of them require hormones, and most of them have been being overseen by a doctor. And I think that it should be part of every well care visit at a certain point, such as a mammogram is.
Well, I would think so, because it's one of the 7 nodes of the matrix. So you're looking at the communication node, and if you follow any of the functional medicine and stuff like that. So first off, let's talk about what can cause the hormones to go awry.
Well, kind of tell them what the symptoms are. So most people don't even know what the symptoms are. So
you have the stage.
Well, and I'm a little, I'll get on my little soapbox because I'm a little more than miffed about it. So I've been a nurse for 12 years, and I hang out with MDs on a daily, not anymore, but I used to. And I have asked, hey, what's going on here? Could it be my thyroid? Is it my hormones? And I get, well, you're getting older. I don't think so. So what was my issues? Chronic pain, joint pain. I'm tired. Brain fog. Cranky. Who cares? I'm a cranky girl. Headaches. I mean, that's kind of the big ones that I have complained about for years.
And it just floats around, sometimes.
Cycles. So it'll cycle around in like 6-week cycles, and it would get worse, and then it would get better, and then it would get worse. And then I had got COVID. I've had COVID multiple times. I'm pretty sure. I know I've had it at least 3 times and probably half a dozen. But it didn't kill me. And and I was able to get over it, but it would just keep compounding the issues. And then I couldn't feel my right foot, but I still can't feel the right foot. So I'm pretty sure that's COVID related, but the pain and things like that. So we just happened to be talking with another provider, and I'm listening on the phone as she's walking through her clinic, talking about all the wonderful things in her clinic and describing them, and then talking about her passion, which was hormones. And so she starts describing issues. And she was kind of trying to describe her treatment, which is the bioidentical hormones, which she does pellets, but I think she also does different things, but her passion is these pellets. And so I'm listening. And so Trevor comes back, and I'm like, hey, I want you to check my hormone levels. And then my testosterone was low.
Tanked.
Nothing. There was nothing there. So that's why I'm getting soft, and I can't make muscles. And I was riding bicycles hundreds of miles a week with no change in my physique and weakness.
And now take this. So let's back up for just 1 second. She sleeps at least 8 hours a night.
Oh, at least, because I like 10.
We eat a very good diet. And there are no added sugars in our diet that I know of.
Only treats once in a while that we choose to eat. but we don't
That's
add anything.
once
We
in a
don't even
great.
have sugar in our house.
So
Honey is about as bad as we get.
what can mess up the hormones? Hi, Kath. The lack of sleep will absolutely mess up your hormones. If you're not getting good sleep, you can't produce your hormones. If you have a diet high in sugar,
I look
high
like a
in
cat
fat,
dragged in. I always look like
high
a cat dragged me in.
in whatever, then the hormones get oxidized. If you don't have good cholesterol and good forms of fat, you can't make your hormones. So all of these things are very, very important.
Well,
And we preach on these things. So she had taken care of her sleep, and she wears the Oura ring. We can watch it, we can track it. She takes care of her diet, and we can watch, we can track her blood sugar, we can track her ketones. Insulin's a little higher than what I would like it, but I can pretty much explain that with she is a stress monkey. She loves to worry about everything. When we look at movement, we do move, ride bikes, we do lots of stuff. Once again, the stress monkey thing is what can really throw it off. And then last but not least is our community of people. And we have a very good, supporting, loving community of people.
well, but not only that though. So other things that can affect your hormones is if you had surgeries to remove your ovaries or your uterus. And even though you have your ovaries, doesn't mean that you can have the ability to produce all the hormones, because what they don't tell you is that your uterus actually provides you with some. And get back on my soapbox. We've had multiple patients that have walked in here without their uterus or their ovaries, and their MDs and surgeons and primary care physicians have never talked to them about replacing anything. So these women have suffered
Well, we did have one come in on
for
conjugated estrogens.
years. For years. And nobody, they check them and see the values, and not one person has ever said anything to them about it.
You know, and this really kind of stuns me, because I really wonder where this came about, because guys' hormones are just as screwed up as women's hormones. You know, we get people who are eating the standard American diet, and aromatase will take your progesterone and move it over to estrogen. So that's how guys get man boobs, and that's how, you know, we aromatize and get estrogens, and guys are starting to get estrogen dependent cancers as well. But why do we cut on women? That's kind of been going in my head, because I talk to guys, a fair amount of gallbladders, fair amount of stuff due to lifestyle and things like that. But we're not, you know, guys don't get weird testosterone and we cut the gonads out. Why do we cut all these things out of women?
But it's the first
What
thing
is
that
the-
a doctor will ask a guy if he comes in and he's tired and he can't function properly in different areas of his life. The first thing
do
they
you have
talk
erectile
about
dysfunction?
is, oh, well, let's just talk you know,
Check your
check your testosterone, and then, oh, we got to fix that. We have to fix that. Well, you know, men and women are, that is so important for their bodies in every aspect. So just to quickly, I'll just tell you what we did. So mine was low, and we were going to start our little peptide therapy, but I was adamant that no, I need this tomorrow, actually today.
Yeah,
And
she was
he's like,
upset
no, let's
that
just
she had to wait
wait.
a week.
And then I was like, no, I'm not going to wait. Like, this is something I can fix. I want to check it out. I want to check it out. So I got those pellets. It's supposed to be 2 weeks to a month, and you would notice something. But I noticed it within 2 hours, within 24 hours. It did not fix all of my problems. It did. I will say 90% of my symptoms went away within 24 hours, though. The hip pain, the joint pain, the headaches, the getting up in the middle of the night, gone. And felt like I had all kinds of energy without the coffee.
Well, you have, because you've been going home and not going to bed, but making dinner. You've made dinner the past 3 nights, and don't get me wrong, she always makes dinner, but the dinners have been the difference in chicken 65 and and more than 2 or 3 ingredients. Whereas before it was, here's
I'd make a salad, throw it on the plate. It was good food. It
Yeah.
was just quick,
quick and
good
easy, so we could just get it over with.
And
And now she's cooking with lots of different seasonings because you probably just feel better and
I
feel
do
like
feel
experimenting.
well, I feel amazing. I feel so good that we went back and revisited every one of our functional medicine patients and told them about it. And I believe most of them have either have their blood work scheduled or have already done it. And all
Even
the
our
ones,
male ones.
all of them. And I tell everybody, I mean, I'm super private, but this is one thing that I have taken on is I'm sharing it with every single person because it's so easily fixed with, and these are bioidenticals. They come from plants. They're not a cancer feeding hormone. And
Your conjugated estrogens are the things that start to give you problems.
yeah, I felt amazing. Like it really was a game changer, life changing. And I think it's so important. Everybody should have their hormones checked, even the young people, because I think their diet, well, and then just
Insulin,
the
just
lack of activity.
blowtorches, hormones.
But once we fix this, then we can worry about something else. But it just seemed like a really simple fix. And the labs they're not that expensive. Now, I will say that the pelleted bioidentical hormones, they're not cheap, but hey, take my money. Like really just take my money if I'm going to feel this great, because it's all about your quality of life.
Well, and that's the thing. We don't know if it's fixed, but does it really matter when you feel better? And we're not increasing risk for bad outcomes.
Well,
And that's the idea here is she feels so good so quickly that we know that there's an issue there. Now, is this going to be where we've broken the dam and now her body starts to do this on its own normally? Or is this something that will have to be just revisited until we can figure out what's going on with the hormones?
well, and so just to give you a little bit about these bioidentical pellets, for men, they last 6 months. For women, they last between 3 and 4, depending on how active you are. They're injected in the hip. And you can get estrogen or testosterone or both, depending on what your recipe is. And they're tailored to you based on your labs. And it costs about $350. We've researched a little bit. They're between $350 and $500 every 3 to 4 months for females, $650 to $800 for males every 6. But if you don't have to put creams on, take a pill, and you feel good and you have good quality of life, you know, women shouldn't stop living their life in their 50s. That's when they're starting to begin their life all over again, because they're not taking care of kids and they shouldn't have the responsibilities. It's just usually when their schedules open up. So women and men should live a good quality life from start to finish. So until the last day God calls you home, you should still be
doing what you want
to do.
So on my side of so we've got a lot to talk about. The IVs have been going. One of our functional medicine patients who has very low, what we call phase angle. And phase angle is looking at the cell, and it looks at the lipid layer around the cell. And that is an indication of how healthy the cell is. And this lady has never had a very good phase angle. And so I was worried about her, and we started her on nutritional IVs. And when we did that, her phase angle is now the highest I've ever seen it. And it's only in 2 weeks of treatment, where she has been on her diet and doing her stuff very, very closely. And she's getting ready to go through another stage of, I call it another lap around the matrix. And she's excited about it because she's actually starting to feel better. So those are the things that we like to see, not just the labs, because to your point, don't treat to a
Yeah,
lab.
don't treat to a lab, because I mean I was going to my MDs are my friends. Like, I see my friends for treatment. So I feel like I can share with them and tell them what I need. And I'm a nurse, so I'm kind of demanding. So I'm pretty sure that's kind of irritating to them too. But at least I know what I want. But I would ask them to do this, or how about this, with nothing.
Well, that's because you don't know what you don't know. And so on my side of things, inflammation in me, we're trying to work on my cholesterol, because my cholesterol seems to be very wonky. It'll be good and then it goes crazy, and it's good and it goes crazy. Part of that is due to diet. Like when we go on vacation, I come back and my cholesterol's nuts again. So I'm kind of looking at that, and we just did some more labs on me, but we're checking my inflammation. And I'm wondering, actually, the hypothesis is because I've had insulin resistance in the past and I keep that spare tire around my waist. Fat is its own pro-cytokine. So basically, it produces cytokines that make you pre-inflamed. And so that's starting to layer on body burden. And the older we get, the less things work and stuff like that. So I am working on I'm using actually a peptide on trying to get rid of the abdominal fat, because I can go work out like a machine and I can actually get my testosterone up to close to 1,000 without any issues. But I can't get rid of this stomach. And my dad had it. My family's predisposed to it. It's kind of, obesity is genetic in my family. And so if we start to use the peptides, as I've started to use the peptides, I'm such a wuss. She has to inject me. I can't do it. I just can't stab myself. I would never make a good drug user. Don't have to worry. Is meth injected?
I don't have any personal experience with that.
Is
I'm
heroin?
sure that
I think
sure that
heroin's injected.
I think that if you give them a syringe, they'll inject about whatever they have.
Okay. Well, if it requires injection,
Yeah,
I won't do it.
I don't know.
Anyway, with that
And
being
now you
said,
know why he keeps me around.
not so you can chase me down and stab me with a needle. So we're looking at this, and we started to use these peptides, and I really didn't see. I mean, I don't think physically I look like I've changed that much.
Yeah, I haven't. I usually notice before you do, but I haven't noticed yet.
And so I hadn't really noticed anything. And she said, "Hey, you've done your 5 days on. You're on your 2 days off. Do another BIA." Okay. So I started at 241.2 and I went to 240.4. I'm like, yeah, I mean, that's nothing much. I'm not worried about it. That's insignificant, put it that way. Did my waist hip ratio measurements. Now, remember, I just got off of doing the Hetox, which did make quite a bit of difference in my cholesterol. I just did my waist hip ratio, and I dropped 0.2%, which is very significant. And then on top of that, when I did my BIA said that I lost 5 pounds of body fat. Now, I would think that I would need to retake the BIA if I hadn't noticed that I actually tightened my belt loop to the last notch. So I know that I have lost size, and I know that I have lost, well, I know I've lost size. And it seems like the peptides, my waist measurement went from 44 to 42. That's 2 inches. And then my hips went down proportionally. So that's why I don't look any different, because the waist and the hips both went down in size proportionally. My hips went down a little bit more, and that's why we see the waist hip ratio changing. And so it's pretty exciting. I mean, the thing that stuns me about functional medicine and all this stuff is functional medicine implementation in the theory is quite easy. We make it really hard as a society because we want our snack cakes in the cupboard and we want to drink beer all the time and we want to have fast food because it's cheap, easy, and convenient. And so that really does take a toll on us. But now we're coming out with these tools. I wouldn't even say coming out. These tools are being rediscovered that are allowing us to really take back our health with very, very little downside. She actually
about peptides because I'm like, whoa, wait a minute.
Well, so no, with conjugated estrogens.
Oh yeah, like
there's lots of problems with cancers and lots of problems with estrogen dominant problems. With bioidentical hormones, those things have actually shown to be protective against cancers and been shown to take estrogen dominant bone loss, heart disease, so cardiovascular, cognitive issues. They've shown in studies where estrogen and testosterone, when balanced, starts to give the body the ability to combat that brain fog. So now that's also with the foundation of having your sleep in order and having
good diet.
Yeah. And it's the combination of doing all of these things and then adding those things in that makes them work.
Well, and we've tried all kinds of, like for specifically me, we've done all of this with little change in the body. So then we have to look for something different. So we started a peptide on a different one yesterday. So his injections are 5 days on, 2 days off, and you cycle through that. And so we chose a different peptide for me, which is supposed to resensitize your
cells to
insulin, so reduces
she does run a little
resistance. Because we can't figure out why that is. And then it's supposed to shrink body fat proportionately all over. It's supposed to help build lean muscle, shrink body fat, protect against brain fog. It protects cardiovascular protection. And
it helps control insulin. And anytime you control insulin, all cause mortality goes down.
Yeah. So this one, it has to be titrated, and it's titrated very small. And so 12 units is a drop.
It says
less than, like it's tiny amount.
It says if you tolerate.
If you tolerate it, you can up it in 30 days. So that 12 units, which is minuscule, lasts all week because you only take it once. And I thought, my thought process was, I'm really sensitive to everything. Maybe I should just cut it in half. And then I'm like, well, no, they said it was okay, and I won't give myself any more than. And within 20 minutes, my mouth is sweating. I was nauseous. I couldn't talk without. So, and that is the side effect of it. That's the number one side effect of this one, is nausea and vomiting. And I thought, oh no, what have I done to myself? I don't know if I can do this for 5 days or 7 days. But I did wake up much better this morning. And so I'm good. I will titrate it up. I'm not sure how
I'm not laughing
work.
at you.
But we're our guinea pigs. Like, we are our own guinea pigs. And if we aren't successful, then we would never roll it out to anybody else. But we would love to help other people.
Well, no, we're helping a lot of other people. It's just
But this is not. It's not. It's a good thing. Like it actually. It's the things that your body normally produce anyway, and they actually help your body balance itself out and do what it's meant to do.
Basically, if you think of it as baking a cake, the pellets are giving you the cake. The peptides are giving the body the batter and it's already pre-made. So as we get older, once we get over 40 years of age, systems just simply start to slow down. And so now you've really got to start to think about optimizing life. And you got to think about food as binary. Food is either good for you or bad for you. It's either building you up or breaking you down. There really is no in between to this. And so when you're looking at these things and you start to figure out how to optimize them, that's what it's all about. But it's all of the modifiable lifestyle factors, as they call them. You've got to be sleeping. If you don't sleep, you can't utilize the hormones. You won't make them, and you won't make your neurotransmitters. If you're not eating good fats, you won't make your own hormones. And so, and then I can go through the rest of them, the movement and the stress and the community.
Well, and make sure you have the ability to make them.
Yeah. And that's kind of like, we're pretty excited about the hormones. And because you have had surgery, this might just be something that you do because you might not have the pieces that it requires to make everything the way that it's supposed to be made. That's where I, as a doctor, I'm always I don't want people on a bunch of meds. I don't want people on a bunch of supplements. I want you to live life and be able to live life without thinking about, oh, do I need to wait 30 minutes before I take this? And that's not a way to live. We want to get you back to health, and then you have this nice baseline that you get to work off of. Well, we've talked about 30 minutes now.
Yeah. Well, follow us on our journey. We're going to keep doing our peptides. We think we're going to try to do them for about 90 days and see, how successful we are. And then we'll do another round. And then in about 6 months, we'll revisit it and see what we're doing. But follow us along for our health journey. And hopefully we can teach you something
Along
to help
the way.
you live yours.
Have a great night.